There are a number of diseases or genetic mutations, or acquired or inherited, that can make one vulnerable to forming an aortic aneurysm or aortic dissection. The classic diseases we think of are Marfan Syndrome or Ehlers-Danlos or Loeys-Dietz. And sometimes these diseases can have other manifestations throughout the body, not just the aorta. There are folks who may have had hyperflexible joints as a kid. Sometimes they may have been more likely to break bones or have cartilage tears or have a sunken-in chest known as pectus, excavatum. And so there are a number of manifestations you may see across the entire spectrum of connective tissue disorders that may cause their primary care physician or their pediatrician or their internist to think that perhaps this patient has a connective tissue disorder and should be monitored more closely. Sometimes for someone who has a connective tissue disorder, depending on where the aneurysm is, that can be as simple as endovascular surgery that may have them out of the hospital in 2 or 3 days. But again, depending on the extent of the aneurysm, as well as the aneurysm's location, that may involve something as major as open heart surgery or a thoracoabdominal surgery. And so it really depends on our team's review of a patient's records and their studies and their overall risk of aneurysm degeneration as to what we feel is most appropriate for them. Frequently, patients with a genetic disorder like Loeys-Dietz, for example, may end up meeting a cardiac surgeon, a vascular surgeon, a neurosurgeon perhaps, and an interventional radiologist and a geneticist may all be involved in their care at one point. And the nice thing about our aortic center is we provide all these specialties housed in one center so that patients can come and get opinions from multiple physicians on our team. We really focus on building the team around the patient's condition and building it around their disease rather than focusing on each of our subspecialties.